So one thing happened in mid-December that about a week before I saw the neurologist in London. My wife and I had set up a plan because I wasn't seeing my family at all, that we would take all the lights off in the house and put on one or maybe two small candles on the dinner table. And I'd come out with my sunglasses on, with my hat on, with my ice pack on. I'd sit with my family for 10 minutes, the only 10 minutes that I would basically see them all week or every day. And then I'd go back to bed. Okay, so the third time we did this, I went out, sat down. After a few minutes, I pulled back my chair, my ice pack fell off behind me, and I went to bring my plates away. I came back from the kitchen, totally forgot about my chair or its existence, saw my ice pack on the ground, and my headache was just going. So I reached down as fast as I could to grab the ice pack and then scurried to the bedroom again, except that I forgot the chair existed, and I banged my head on it right on where my glasses connect. I fell backwards, knocked myself out for probably about 5 seconds. Didn't really feel any pain, but I had a cut on my nose. And then I proceeded to the bedroom. My wife and I couldn't tell if things got worse. They certainly didn't get any better. And I didn't really want to admit to this sequence of events to very many people, as it seemed kind of foolish. Anyway, so we saw the neurologist. In London, she said I had post-concussion syndrome, don't go back to work. And because neurologists are so busy, she said, you know what, I'm going to refer you back to your general doctor. And I found that there was a place called Archway Health and Sports Services. It's an accredited concussion management clinic in Sarnia, or just outside of Sarnia. And I was able to call them up, and we set up an appointment to go there. In early January, I started being seen by someone there weekly. I massively failed or maybe passed the post-concussion assessment test. Either way, it was very clear that I had big brain issues. Anyway, I proceeded to see him for a while. I continued to make slow progress, and eventually I got a drug actually from my family doctor that was helpful and helping me handle a little bit of music. Unfortunately, it was making my stomach really upset and caused me all kinds of issues. And so I had to discontinue that drug and find one that's much less effective. Also in April, I saw the neurologist in Sarnia, who is a recent graduate neurologist and was very up to date on post-concussion syndrome and has been seeing me regularly since April. And so I've done Botox. I've had nerve blocks in the back of my neck. Not recommended, very painful, but they help a little bit. Botox, on the other hand, didn't help me, but it does help lots of people. It just made my forehead turn bright red all the time and didn't help much. Unfortunately, it also lasts for 3 or 4 months, and so you get a red forehead for 4 months. Anyway, I was also referred to Parkwood, St. Joseph's Healthcare Hospitals in London. Parkwood is sort of the gurus of brain injuries and dealing with concussion-based injuries. I went to an outpatient where I went there 6 sessions over a month and a half, one day, one afternoon a week. And so they focus on, this is where you're at now. You may get better, you may not. How can we make the best of your life with whatever things you can do and make life as enjoyable as possible through planning and pacing and doing all sorts of different things. One thing before I forget, Parkwood has a website that they've updated. It has all kinds of amazing resources on it. Just Google Parkwood MTBI or MTBI 101 sessions. And there's tons of resources there. Okay, so in the past few months, I also saw an eye specialist, Dr. Cheryl Letheren in London, absolutely phenomenal. And so I have these new sort of fancy glasses that are helping my brain work through things a lot easier. I have custom earplugs that help lessen sound tremendously, which helps a lot as well. I also receive physiotherapy. I know all kinds of exercises and things to do, and pacing and so on. Excuse me. I still can only drive really, really short distances, and it totally wears me out. I can't run or do very active things because it's just too much on my brain. Once my heart rate gets to a certain height, I just turn straight into massive headaches. I don't know if I will heal, how much I will heal, whether my ears will heal but not my eyes, or what parts or what degree. But sometimes we don't always know what our future is. In fact, most of our lives with faith, we don't always know our future. We just take each day and enjoy it as best we can. Brain injuries, there's no way of knowing, especially with these type, how severe they are yet. Healing from a brain injury is measured in months and years. If you're in this healing stage, don't lose hope. Always be amazed at the neuroplasticity of the brain. And there's all kinds of studies and all kinds of books that show that the brain can keep healing and keep doing marvelous things. Lastly, remember, no two brain injuries are the same. They can vary tremendously from one to another, and day to day, even sometimes my symptoms can change a lot. Switching gears here, a few useful resources. One of them is the We Fit, or the We Fit Plus. It is full of, it has a whole bunch of yoga exercises which help you practice the deep breathing, and it's great for flexibility. It also has a whole bunch of balance exercises you can do that help with your balance system and a little bit with your vestibular system, which is your head in space. All right, another thing I wanted to talk about is Return to Learn. On the screen, you will see that there are a few different associations, medical associations, that have Return to Learn frameworks or protocols. And you can go through the stages in as little as a day a stage, ideally, and in the NHL it usually is about a 2-week stage for the least amount. Or you can get stuck in each stage for days, weeks, months, years. It's not every day is a good day, but there's good in every day. Return to Learn with students, you can take one class at a time, or you can do 10% at a time. Someone else can take your notes. You can leave class whenever you want and come back whenever you want as your brain handles with things, and you can go back and forth. With working, that doesn't work so well. So you might be able to do one day a week, but typically employers want you to ramp that up. And with a lot of other injuries, that would make sense. But with brain injuries, you don't know when you can ramp it up. You usually have to start with a few hours at a time and do that for a month or two and see how it's going. It might take a month to find out that it's too much. And then you have a total crash a month later where your employer is expecting you to move up and you actually have to go down. And employers don't want you to stay at 1 or 2 hours a day forever. They expect you to keep going forward, where you might be there for a year or 2 or 3. And so that makes it really tricky for employers. You can obviously see how that would be a problem if you're a paramedic or in a whole bunch of jobs where you're expected, you can't just stop partway into teaching a class or partway into fixing a car. And that's the next thing I wanted to transition into. If we think about cars, they have a gas tank light often that comes on, and you have 50 to 80 kilometers you can go. With a brain injury, so normally when we get tired before having a brain injury, we know we can finish the rest of the day or the task or a few hours, and then we might go to bed a few minutes early or half an hour early or sleep in a little bit or whatever. With a brain injury, your gas tank light goes on when you have about a kilometer left. So it's I'm feeling tired and I'm going to fall over in about 10 steps. Or I'm feeling tired and I'm going to have a massive headache and then fall over in a few steps. So just be aware of that. Sometimes we'll appear rude when we have to get off the phone quickly or leave a conversation or something else. It's just we get that feeling and that gas tank goes. One thing I wanted to also touch on, a brain injury is unlike any other injury, and I kind of talked about this. When we think of injuries, we think of stairs and healing from them and recovering back to normal or back to the same. We think of a bone takes 3 to 6 weeks, and a muscle takes a few weeks unless you do a really good or bad job on it, and then it takes a little longer. We kind of have set time frames. Well, once you talk about mental illness and once you talk about brain injuries, you have to throw away that time frame way of thinking. With brain injuries, it's stages, and you can get to the next platform, the next level, and you might be there for a much longer period of time, and you might actually have to go backwards. I also just want to talk briefly about, you see the tape on my eyes, it's called binasal inclusion, I believe. Basically, it's just there so that my eyes don't have to think about as much of the space that overlaps that they see, and my brain doesn't have to work as hard. So you think about using stools, sitting down, doing things, and writing lists, and using different memory strategies. All things to make your brain not work as hard, and they can be used for anyone. Everyone can benefit from not having to make their brain work quite as hard, and to enjoy it as much as possible of each day. Try to exercise. It's really important. Wait until after you get doctor's approval, but then even just a slow walk every day. Try to make sure you do some exercise every day. Not only does it keep your muscles from getting weaker and weaker, but it's really important. It's really well known, well researched, that it will help your brain heal faster or recover faster. Okay? Set a goal to work towards. Don't set a timeline or a time limit, but just set a goal, a certain distance, and slowly work towards it. If you miss a day or two, that's okay. Just start again. Keep trying, keep setting goals, keep working towards them. Okay? Exercise is so important to keep doing. It is something called musical ear syndrome. It's not very well known, but what can happen to people who have lost their hearing, or they're finding people who have had brain injuries and have to totally avoid sound as much as possible for periods of time. They can get what's called musical ear syndrome, where one part of their brain really can't handle any sound and the other part of their brain is bored. So they're looking throughout your brain for sound recordings, and then they just play them over and over again inside your head. In my case, it was first it was clock bells over and over again, very annoying for a few seconds, and then it was MASH, the introductory musical theme song. The first 5 seconds of it would go over and over again for days and days, very annoying as well. And so that would actually make my headaches worse, and I couldn't put earplugs in or do anything about it because that didn't help. Even though I did all 3 segments and it's 41 minutes long, I still miss talking about some quite important things. I miss talking about mindfulness and deep diaphragm breathing. I miss talking about using timers, use them especially for all those red items, the things that you can't do very long. I miss talking about musicians' earplugs, which are also very useful. I miss talking about posture medic and the physiotherapy exercises that go along with that. I really miss talking about making a specific plan for each day and each week, and stick to it very, very carefully, because things add up very, very quickly and can cause issues. So look into those things yourself. Hope you enjoyed my videos.